Mealtime is more than a bowl of food. It's the foundation for a long and healthy life. At Wellness, dry recipes are crafted with the highest quality natural ingredients for a taste that pets love, and scientifically proven through AFCO feeding trials to ensure that every complete and balanced meal supports the 5 signs of well-being. With Wellness Pet Foods, pet parents can share a life of well-being together with their pet.
Welcome to Veterinary Vertex. I'm Editor-in-Chief Lisa Fortier, and I'm joined by Associate Editor Sarah Wright. Today we have Andrew and Sarah joining us to talk about a very important clinical disease, laminitis, and cooling the hoof lamellae. Andrew and Sarah, thank you so much for being here today and bringing on an equine podcast for us.
Thank you.
Thanks for having us. All right, let's trot on over. So, Andrew, your AJVR article discusses how distal limb immersion in ice and water is the most effective means of cooling the equine hoof lamellae under clinically relevant conditions. Please share with our listeners the background on this article.
Well, I think cooling feet for laminitis prevention has become, and early treatment has become something that's fairly commonly done. And our research group, going right back to when I did my PhD with Chris Pollitt, we have looked at the efficacy of cooling to prevent laminitis in experimental models. And we've always used ice water immersion in those situations, either in boots or in recirculating tubs. And ice water immersion is difficult to practically do in the clinic, but our suspicion has always been, and some of the data that's been generated has backed up the fact that ice water immersion is probably the most effective way to cool the lamellae themselves. But there's been at least a couple of papers in the last 5 years that have perhaps had results that are at odds with that. One that showed that an ice pack system could be effective, and one that showed that an ice sleeve that didn't include the foot, that didn't include water, could also be effective. And in fact, that method we'd used here at New Bolton for quite some years in a clinic. The difficulty with ice water immersion is that the horse has to carry around the ice water column. So the weight of the water itself is very difficult and impractical to ambulate around with. So I think in clinical situations, we've always searched for methods that might be more practical. This paper, we wanted to see if by actually measuring lamellar temperature itself within the tissue and trying to perform these studies in clinically relevant conditions inside stalls with horses free to roam, whether in fact these other methods could be as effective as ice water immersion. That's the short answer.
No, it's a very good answer, actually. Very good summary. So, thank you. So, now what are some of the more important take home messages from this article?
Well, I think it shows pretty clearly that ice water immersion is much more effective than other means. And I think that's not a big surprise to us. But I think the reason there's some disparate information in the literature is because the location at which you measure temperature and the conditions with which the horses are kept in these experimental studies make a big difference to how the temperature data appears. So I think we took a lot of care in this study to try to make it a realistic study. The question, I guess, now is, how cold does the tissue need to be, and for how long? But I think this is at least a step that shows that these ice water immersions are better. What's the important take-home message? I think, it's the important take-home message is in horses that are at high risk of laminitis, or in horses that are experiencing early signs of acute laminitis. If you want to cool their feet, I think you need to try to do ice water immersion. And if you can't do it in the situation you're in, it's a good reason to refer a horse to a hospital where it can be achieved.
Andrew, it's a good point of like how cold is cold enough. Given your vast experience and obviously you're a key opinion leader in this area, what's your gut instinct tell you what is cold enough?
Yeah, I don't know. But and we've always tried to make it as cold as possible because we've always been trying to look at, um, look at changes, look at effects in experimental models, and so we're always trying to go for the maximal difference. And uh, in those situations, the prophylactic effects are really profound. They're not small. They're really profound. But there is literature in models of acute lung injury and other things in rodent models showing that small differences in body temperature, even 5 degrees of hypothermia, 5 degrees Celsius, lower than normal, can make differences to acute lung injury, for instance. So, I think it's possible that even small differences can help. Small cooling effects can help, but I think our overwhelming experience is that the colder the tissue is, the better, when you're talking about laminitis prevention and stopping it from progressing.
That shouldn't be a problem here in New York. It's pretty chilly, so the hoof capsule is plenty cold here.
Yeah. So
Sarah, I'm sure you know you're incredibly fortunate to be amongst Andrew and the other, and just the vast amount of experience around New Bolton Center. What sparked your interest in laminitis?
Yeah, so I first came to New Bolton, I guess, in 2020, and I was a Mars Equestrian Research Fellow. And during that time, I got to like kind of work with the Laminitis Lab and Andrew. And really his passion for the like looking into laminitis and everything really made me interested in it, even though I would partially say it wasn't, my topic of choice previously, but I really enjoyed my time there and like he's so intrigued by it that it then makes me excited about it. So, then like my second year in the research as a research fellow, I really got more involved in it as well and really started to enjoy it.
Yeah, it's nice to be around thinkers, right? And Andrew and his group have always been, like you said, it rubs off. It's the bane of my existence as a equine orthopedic surgeon. So knowing that somebody's looking and really thinking about this horrible disease for our horses is really wonderful.
Yeah.
Andrew pointed out that you kind of predicted the main finding of the article given all your other research experience, but every time we do studies, we find something that surprises us. What surprised you from the findings in this article?
Yeah, I think I was just surprised how much of a difference there really was between just using the plain, like, ice in a sleeve around the hoof compared to submerging them in this ice water immersion. Like, I always knew it would probably be better, but I just didn't expect there to be such a drastic difference between all the different methods.
Yeah, now now that you know that, do you watch, like, football players differently where they jump in their little ice bath or
Right. Yeah.
yeah, or you think of, like, the old cowboys, right? They knew when their horses' feet hurt, they walked them into ice cold streams. They
Yeah.
were onto something a long time ago. It just took the brains of Andrew and Pollock and others to prove it.
Yeah, and when you walk around the racetrack, they have them standing in, like, buckets of water up to their elbows, and I was like, "Hmm, okay."
Yeah.
So, Andrew, you talked a little bit about some next steps, like, for example, like how cold does it need to be? But what are some other next steps for research in laminitis?
well, in laminitis in general, I think we still there's still some missing pieces in terms of exactly what causes laminitis at the cellular level, uh, in different situations, although we've got a lot more information than we did, say, 10 or 20 years ago. But there's still a little bit more to go. And I think uh, there's a lot of progress on particularly the endocrine side, better management of endocrine disease for prevention and even treatment of laminitis. And even though there's some holes there in terms of, better understanding and better management, I think overall that's where most progress has been made. Back at this sort of supporting limb laminitis side, um, there's still some some levels of understanding that we have to get to, but I think we are making a little bit of progress there. And then, funnily enough, that most of the research had always been done in sepsis-related laminitis, particularly with the cooling and the models that we were using to test it in the early days, and that's really stagnated. And I think partially it's because the cooling does seem to be effective in the clinic, and we here at New Bolton Center, most of the laminitis we see in these sick horses now is Botonic horse fever, I'd say. And in those cases, it just happens so rapidly. I think a lot of the time they're laminitic even before we see them. But I think that's an area that we're actually kind of interested in working out why that is such a profound cause of laminitis in our population. But I think there's still work to be done on understanding how we can better use cooling, how cool it has to be. And there's still development that needs to be done. And hopefully we're working with some of these companies to come up with better solutions. So some of the companies that contributed equipment for this study have modified their boots to try to make them better. In the aftermath, and there are some more prototypes coming. I'm hoping that we can come up with more practical ways to cool feet that are more effective and easier for people to use in the clinic.
Yeah, I'm just going to take this opportunity, Andrew, to shout out to anybody who's listening. Don't let your horses get fat. I think many of us, now that there's a stall side insulin test, it really should be part of your spring and fall checkup on your horse. You might not think your horse is overweight, but most horses in the show ring, not necessarily the race horses, but at least in the show ring, most of them are over conditioned, as my mother would say, well covered. Uh, yeah, and Andrew, I don't know what to think about those Potomac horse fever horses. Some of them are, I think they're in DIC before they even get across the threshold. I don't know that any icing is going to help them.
Yeah, I think my suspicion is that the Neorickettsia actually, it's replicating and causing havoc within macrophages that are resident in the lamellae, the tissue itself in the foot. And so in most of these other causes in sick horses, you've got this systemic inflammation and maybe endotoxin or other products circulating that are the tissue and the cells in the lamellae are reacting to, and that's what's setting them off. Whereas I think in Potomac, it may be happening locally and it happens very rapidly. And I think probably we just don't get the chance to inhibit it. But
Wow.
Very cool. Now, Andrew, since the last time we talked to you, we've added a fun new question. It's about AI. So do you see a role for AI in laminitis research?
oh, absolutely. I mean, I think in laminitis research, there is, particularly as we start to get access to more of these tools for sort of big data, um, AI can help sift through and look for patterns and look for associations in genetic basis or in protein profiles. But the other thing is, and we're actually quite into looking at in horses that are prone to supporting limb laminitis horses, the fractures, looking at locomotory patterns in those horses and how they might predict whether that horse is at high risk of developing supporting limb laminitis. And until now, we've mostly used foot-mounted sensors. And in fact, Sarah, during her time in my lab, did a whole bunch of work with foot-mounted sensors on horses with fractures. And that's shown us that those horses have lower rates of ambulation and don't move as much as normal horses, and perhaps gives us some information on how we can predict risk. But I think now we're trying to take it a step further. We used a bit of machine learning in those protocols, but now we have video cameras set up on these horses that have fractures and breakdown injuries, and we are developing models that are AI-based to quantify ambulatory behavior and laying down and standing up, in the hope that we can use that to better predict risk. in those horses and warn us early. I think it's an exciting time to be alive. Probably the most exciting time because maybe in 10 years the AI will be doing the thinking for us as well. But now we can do the thinking and apply it.
I think you're safe. I remember Andrew probably 30 years ago at a VOS meeting, Jeff Watkins saying preferred horses that had stall vices when he was doing fracture repair, like the weavers and the pacers and that. And he said because they're far less prone to founders than the horse that just stands there.
Yeah,
So
and I think it was Larry Bramlage who was into walking and still I think down at Root Real they like to walk them. I do think it's a kind of leap in understanding, and I think we probably will have another podcast on this at some point, at least for the future when I send this paper into you. But
yay.
I think that it is something that we can potentially work on and understand better, similar to perhaps some Ilias in people post-operatively when they kind of worked out that hey, you just got to get people up the next morning after their surgery and get them walking up and down the hallways.
Yeah.
That's
Unfortunately, the walking the horses is a bit cumbersome when you want them to be iced. So pick your poison.
yeah, yeah. Cool.
For those of you just joining us, we're discussing how distal limb immersion in ice and water is the most effective means of cooling the equine hoof lamellae under clinically relevant conditions with our guests, Andrew and Sarah.
Hey, Sarah, you've heard Andrew talking about this vast depth of manuscripts and articles and research that are behind this article and that came before here. How did your training and previous work prepare you to write this article?
Yeah, I guess it was really all my time when I was the Mars Equestrian Fellow working with Andrew, and getting to do real-time laminitis work and the different variety of projects that we were working on to really help write this and put it all together to help further my knowledge in the topic would probably be key, as well as like other clinical experiences, like firsthand treating clinical laminitis cases.
So, Sarah, this next set of questions is going to be really important for our listeners. And the first one deals with the veterinarian's perspective. So, what is one piece of information the veterinarian should know about equine distal limb immersion in ice and water in cases of laminitis?
So kind of as a two-parter to that answer. So I think it's key for them to know that ice water immersion is way more effective than just using plain ice. And you'll get but should get a better response to these horses, but also that since it is kind of cumbersome, and these horses probably need a little bit more monitoring with the ice water immersion, that it would be better for them to be managed in a clinic or some sort of hospital setting as opposed to just managing at home under the owner's care for full effect.
Now, on the other side of the relationship, what's one thing clients should know about this topic?
I guess it's kind of the same for clients because one thing the clients care about most is probably cost and effect. So it's probably going to be a little more costly to come refer them into hospital. They may want to manage them at home. I mean, if you have a really dedicated client, I think they could probably do it. But I know like here, we usually are checking ice boots every 2 hours, making sure they're still on properly, they're still full, because some of them like to play with them and take them off themselves and all that. So I think that's something they need to be aware of as well.
Yeah, it's hard to do that stuff on the farm. It's just
Yeah.
hard. I remember my first horse that got a really bad foot abscess, and I tried to follow my own instructions. I was like, soak it in a bucket. That's the dumbest thing ever. I was wet. The bucket was under my horse's foot. It was flinging around. It was like, who came up with these instructions?
Yeah.
I mean,
Yep.
until you do it yourself, you don't realize. And one of the boots that we used for the first experiment one in this study, one of the soft ride boots, we just had terrible time keeping them on. And so we invited Monty from Soft Ride to come and yeah, he was kind of swearing and throwing his hat on the ground and stomping on it, and he went away with a bit of fire in his belly to make something better, and he is actually still on it, and I think it is happening. So, um, but yeah, I think you don't. It's all well and good for us to say, "Hey, ice this thing continuously for several days," and then you'll be good. But I think in reality, it's difficult, particularly with the tools we have available to us right now. But hopefully going into the future, we might have some slightly better ways to do it. Like,
Yeah, I think you're right. You showed the research in a clinical application, like in this manuscript, how important it is, and then technology will follow. Companies will follow along because they know it's real. Thanks again so much for filling my heart full of equine, even if it is laminitis. It's a good way to end my day. Um, so as we wind down, we like to ask a little bit more of a fun question. Sarah and I have a hypothesis about this question, and we're going to do a follow-up study, a retrospective. Um, Andrew, when you do a puzzle, do you begin with the exterior and border piece, or do you do a theme? Do you do a color? Are you a hybrid person?
totally the border, yeah, border in the corner,
Yes.
no doubt. I don't think there's any other way really to approach that.
Amen. Sarah, how about you?
I'm the same. I like the border. It really sets the boundaries. I think I mean, if I find a piece that matches while I'm doing the border, then I'll do that. But otherwise, I think it's a little unhinged,
Oh, you're an
starting from the middle.
Yeah, we do a lot of puzzles in my house, especially around the holidays. So my one daughter starts in the middle, and it drives, and she's in medical school and not going to be a surgeon. So now mine and Sarah's hypothesis. It drives me crazy, and I'm like, you stop, take your insides over there. It drives me nuts.
I feel like they make a puzzle now that has no borders.
I don't know.
And I
That's not a puzzle.
right? I would it's
I'm
like
not
no
buying that.
no end pieces or something like that. I feel like I saw something like that and I was like, I would never.
Nope.
We had a weird one over the holidays where it was like 4 puzzles in one. So it was one picture, but you had to put together like all 4 parts. And I was home with my family. My brother's an engineer. So he started with the border, I noticed, because now I'm like paying attention to this after doing the podcast. My sister does childhood development and she started with the middle. So it was really interesting. I'm a border girl myself, but the 4 in 1 was challenging. So thank you so much again, Andrew and Sarah, for being here and for sharing your knowledge with our listeners. Sounds like we might have some more from you in the future. So hopefully we'll have you back on the podcast.
Thank you so much for having us.
Yeah, thank you.
And to our listeners, you can read Andrew and Sarah's article in AJVR. I'm Sarah Wright with Lisa Fortier. Be on the lookout for next week's episode, and don't forget to leave us a rating and review on Apple Podcasts or whatever platform you listen to.